So what promise do vitamins show for people in hospitals with severe COVID? Dr. Daniel Monti, integrative medicine specialist and co-author of Tapestry of Health, joins me to discuss his current clinical trial using vitamin C to fight COVID-19. So tell me, how exactly are you using vitamin C in your study?
All of the patients in our study are hospitalized at Thomas Jefferson University Hospital in Philadelphia with COVID. They are that group of patients who do not need to be in the ICU, but they need to be hospitalized, requiring supplemental oxygen, bronchodilators. And the whole goal of the study is to see if the vitamin C can give people an edge, given the very limited treatment options we have right now for COVID, in getting past that stage that they're in, discharged from the hospital, and not needing to go to the ICU.
But the question is, when you talk about using the vitamin C, what are you looking to see what it does in the case of a situation like COVID?
People will get escalating doses of 3 infusions, and that last dose can be as high as 100 grams, depending upon body weight. But first, we want to make sure that people can tolerate it, and we screen them very carefully. The hope is that the vitamin C, because we know some of its role in immune processes, will trigger lymphocytes to do their job more efficiently. Because the problem with many subgroups of vulnerable patients is they get an inadequate lymphocyte response. First, it's sluggish, and then there's an overdrive response where there's cytokine storm and those kinds of things. And so we're hoping that the vitamin C actually gives people that edge so that they can get over the illness quicker and get out of the hospital.
Now, when you talk about lymphocytes, explain, how important that is in the immune system response.
Lymphocytes are an important type of white blood cell, part of the immune system. They're important for passive immunity. So when people get a vaccine, helping to sort of remember the response, and also for active immunity. We've seen in some studies, for example, that people who were very deficient of vitamin C did worse in certain types of situations like sepsis, where you have a bad systemic infection. So our hypothesis, based upon the data we have and the team that we're working with, from infectious diseases experts to people at the National Institutes of Health, came up with this protocol and the rationale for it. It is relatively low risk. However, that doesn't mean that people should be going to outpatient clinics getting big mega doses, because we don't know if there's any kind of a preventive effect in that regard.
Well, Dr. Monti, that is great information, and we look forward, hopefully, to the results of your study to see whether or not vitamin C could be another weapon we have in our arsenal against COVID-19. So we wish you well in your studies.
Thanks. Check in with me in about 3 months. I'll let you know how we're doing.
Okay, we'll do that. Thank you.